Hello.
Hi everyone, we're going to start at 5:03 just to let people join the meeting, so welcome.
Have you heard the bad news? Sir Tom has just passed away. Captain Tom, bless him.
Yes, I read about it and I'm really sad.
Yeah, hi, how are you, Bridget? I've been
Hi,
trying to speak to
Rita.
you.
Yeah, we'll talk.
We'll talk later, dear. Very sad news.
Yes, yeah. I'm so sad about that. Yeah.
Hi, good evening, everyone. Hope that everyone's okay. My name is Jeanette. I'm Head of Community Engagement at the Greater London Authority. It's really great to welcome you all to another Faith and Communities briefing. We've been hosting these for a few months now, and I hope that all of you who attend have found them to be useful spaces for information and for asking questions. We once again have a number of people who are going to be sharing with us. Professor Kevin Fenton is with us again, and Martin Machray is with us again today. But before they come to speak to us, I'm going to invite Deputy Mayor Debbie Weeks-Bernard to introduce the session. So Debbie, over to you.
Thank you so much, Jeanette, and welcome to all of you. It's really lovely to have you all join us again this evening. We do really welcome you all, giving up an hour of your time to spend with us, to share with us your thoughts, your comments, but also to raise the questions, any of the questions that you might have that will enable you to continue to do the really important work that I know that you're doing to support Londoners in this time. So it's another public health, community, voluntary and faith sector briefing. And we know that it continues to be a time of real crisis. So last week, many of you will have seen that we had now passed over 100,000 individuals who had lost their lives across the UK, and 12,000 of those individuals were here in London. And it's very clear that every single person who has been lost to this awful virus is a tragedy. And I know that all of us have been affected by this pandemic in a number of ways, but for those of you on this call today, if you have lost a loved one, a relative, a neighbour, a colleague, I do extend to you my most sincere and heartfelt condolences. I know also that there are thousands and thousands of grieving families up and down the UK today, and so it's really important that we always recognise why we are here, why we meet, why we come together to have the discussions that we have, and it's to make sure we are doing all we can to stop the spread of the virus, to give individuals the up-to-date and accurate information that they need, and for us at the GLA to continue to support you in making sure that you have all the information that you need to continue to provide that amazing and ongoing support that you are providing. And for that, I do thank you. And I know that everyone on the call from the GLA, from PHE, from NHS England also extends to you our thanks for all that you continue to do for communities across our city. So as always, following this meeting, we will share details of where you can go to find any of the useful resources and information that we might mention during the call. There are staff on the call this evening who can answer some questions in the chat that you might raise. But as ever, I'm really delighted that we have with us Kevin Fenton and Martin Machray, who will shortly be providing some updates, and then we will open it up for questions. So as I mentioned, that accurate information is incredibly important, and whether it's speaking to close family members or helping to promote pro-vaccine messages that are being voiced by very respected leaders in the community or trusted health professionals, if we can all persuade just one person who might be hesitant about receiving a vaccine, it will make all the difference, potentially saving lives within our community. I know myself, I had just a few weeks ago, was called during the same week by two separate people who I know very well, both Black women, both working in the health and social care sector, who had been offered the vaccine and were worried about taking it up. And we spent some time just exchanging messages, and they wanted just to ask me, you know, what I thought about the vaccine, would I take it if I were offered it? And I gave them my most honest opinion and said yes, and told them why. And I know that both of those women went on to receive the vaccine following the chats that I had with them. And I know that it's impossible for us to go out and speak to every single person individually, but I felt as though I'd done something really incredibly important that week, because I knew that they had come to me privately because they had concerns and fears, and all they really wanted was someone to listen, to hear them, and hopefully just to answer any questions that they might have. And so it's really incumbent upon us to make sure that we are giving every individual who has the opportunity to have a conversation like that, either one-on-one or with the communities that you serve, the information that you need to be able to participate in similar sorts of conversations. Okay, so I'm going to very shortly ask both Kevin and then Martin to speak to you, to provide you with some updates. But just some very quick housekeeping. Everyone's been put on the call on mute, just to ensure that everybody else is able to hear the speakers. But please do use the chat to introduce yourselves, to raise your questions, to make any comments. And as I've mentioned, the team are monitoring the chat and will respond to questions as we go along. And we're also recording the session in order to be able to share it with those who are not able to attend, so you can share it with your networks also, because I know that this was an issue that was raised in a previous session. Okay, so really pleased to have with us tonight, as ever, Professor Kevin Fenton, who's the Public Health Regional Director for London, and Martin Machray from NHS England. I'll first hand over to Professor Kevin Fenton to provide an update, and then swiftly we'll pass over to Martin. So over to you, Kevin.
Great, thank you, Debbie. Good evening, everyone. I think I was going to say maybe this is the first time we're speaking for the new year, Debbie. Time is moving so fast in these COVID times. But it's good to be back with all of you again. And I'd like to also begin, as Debbie did, by reflecting. I think the passing today of Captain Tom, Sir Tom, I think is hitting so many of us in ways that are unexpected. And it brings to mind again why this pandemic and the impact of this pandemic is something that we should never, ever forget. And we should never, ever stop fighting. And, you know, I look back on a year ago when he came to the fore in the news, and the light that he provided at a time that was particularly dark and uncertain for many of us. And he's always been that sort of beacon of hope. So his passing today, I think, is touching me as I reflect, as Debbie has said, on the fact that more than 100,000 of our fellow citizens, of our family members, of our friends or colleagues have been affected by this disease and have died from this disease. And I think both the news today, the challenges that we still face, but also the amazing opportunities means that we have a time this evening just to focus on what we will do together to get beyond this. So in the time that I have today, I'm going to be very brief because what I've learned about these sessions is that the richness and the power of this session is actually in the questions and the conversations that we have. So there are 4 things that I wanted to do this evening very briefly. First, to give you a brief update on where we are with the epidemic in London and what we need to do to continue to control the epidemic and where we work together as partners to ensure we have that good control. Second, I'm going to touch on a couple of things which are in the news at the moment, the new variants and what that means for us as a city. And second, maybe touching a little bit on vaccine hesitancy, but I know that Martin's probably going to be speaking a lot about that as well. And then finally, I just would like to look at the next 2 to 3 months and what's likely to come up as we prepare for the end of the lockdown, reopening of society. But more importantly, how do we prepare our communities to take full advantage of that as well? So those 4 things I'm going to cover very briefly this evening. So first, that as far as the effectiveness of the lockdown is concerned, we are seeing really good impacts on rates of disease, as well as numbers of cases falling in the city. And that fall in new infections is having a positive effect on the NHS. But the pressure on the NHS remains very significant, both in general and acute beds, as well as in the ICU. And of course, people continue to die from the infection. But at least the community transmission of the infection is a lot lower. And to give you a sense of how much lower it is, on a daily basis now, we're probably diagnosing between 2,000 and 3,000 people each day with COVID. Whereas in January, at the peak of the infection, we were diagnosing between 17 to 19,000 people every day. So that just gives you a sense of just how much infection there was and the pressure that had put on the NHS throughout the Christmas and New Year that Martin and his colleagues have been responding to superbly. Now, with those reductions in infections, this means that as we move through the lockdown, and the government is going to do a formal review in February, the week of the 14th of February, decisions will then be made about, do we have enough suppression of the virus in order to ease restrictions? Do we need to continue restrictions because of the new variants, not enough suppression of the virus? Or do we need to think about a phased reopening of society, very similar to last spring, where we perhaps open schools first, then you begin to open different sectors? No decisions have yet been made, but these are the conversations that we'll be having as we look at the rates across the entire country. So that's where we are with the epidemic in London. Positive signs, but we all need to encourage our families, the communities, to keep the pressure on, staying at home, observing the rules, to drive those infections down. And to give you a sense of where we need to get to, when we emerged from lockdown in the spring, we were seeing fewer than 200, 300 infections occurring across the city, very few infections occurring across the city. So from where we are today, we still have a way to go. And that's why I think working together is going to be so important. Second, I'm going to skip to the new variant because that has been in the news over the weekend. We're doing some really important work in the city now to try to find those new variants. Now, the 3 key messages here are, number 1, variants and mutants occur with all viruses, and it's a key part of how viruses spread. Because we have good genetic typing and genetic sequencing infrastructure here in the UK, it means that we're able to test samples to look for these new variants. And those new variants, whether the Kent variant, which we responded to in November, December, or variants such as the South African variant, which you're hearing about now, as well as the Brazilian variants, we're tracking those in the city all the time. Now, more recently, we've begun to see new variants of the South African variant that didn't have any history of travel abroad. So these are people who were diagnosed with a new variant, who live in London and haven't left the city. So we really are concerned that this may indicate some spread within the city. And that's why we're doing this intensive local testing in areas and in the postcodes where the people with the variant live, to see if we can identify any more of those infections. Now, at the moment, we think that the prevalence of those infections are low because we've been in lockdown for so long that the transmission of any virus is going to be really hard at the moment. But at the same time, because so many infections can not have symptoms, we want to ensure that we're testing for it. So the key message, I think, for us today is that London is part of the new Project Eagle. We're looking for these new variants. We just want to make absolutely sure that it's not spreading in the city. And if it is, we have everything to put it under control. Third thing is just on vaccines. I'd like to acknowledge leadership again of Martin and NHS colleagues. They have reached a phenomenal milestone of more than 1 million people now receiving their first dose in the city. However, when it comes to the uptake of the vaccine, we're seeing significant variations across different groups. And I think, as Debbie said at the beginning, it really is important that we all play our part in speaking to family members, community members, people we're in contact with, about the importance of the vaccine. And the way I frame this, especially for disadvantaged communities, is that this epidemic has really taken a severe toll on so many of our communities, especially here in London. And at a time when we now have a tool that all of us are hoping for that can bring an end to this epidemic, now is not the time for us to pull away from that tool. In fact, we should embrace it, recognizing concerns that people have, but recognizing that this is going to be a part of helping us to get out of where we are now in terms of more people being protected, less infections being transmitted, and people being healthier. So we are doing lots of work across the city on vaccine hesitancy, promoting the vaccine, answering questions on the vaccine, and I'm sure we'll do more of that today. But I just wanted to thank all of you for the work that you're doing on this. Now, finally, just to wrap up, what's to expect in the next 2 to 3 months. As I said, government is going to review where we are the week of the 14th of February. At that time, decisions will be made about whether we remain in lockdown for a bit longer in order to suppress the virus, and then to consider how we exit from lockdown, given the fact that we will have vaccinated the most vulnerable, have a strong testing and contact tracing system in place, and strong partnerships such as the ones we have here to support communities moving forward. As we prepare for this time, I think there are 3 asks that I have of everyone here. So number 1, let's not take our foot off the pedal until we have reached the finish line. The last thing that we need now is for people to feel that we're out of the woods, because we're not. Martin will tell you the pressures on the NHS are still severe. We're still seeing lots of people dying from this disease, and we need to suppress the virus more. So everything we can do to encourage people to pay attention to the rules and to stay at home, that will help us to get out of this. Second, we need to ensure that we prepare the population for exiting, and that is ensuring that everybody who needs a vaccine gets one, and vaccines are going to be a key part of unlocking and emerging from this part of the lockdown. So again, not only do we need people to protect themselves, but the more communities are protected, the better we will all be. And then the third is, what's different now from last spring is that we have so much better infrastructure in place to address the epidemic, from a better testing infrastructure, local testing sites, contact tracing, support for self-isolation. So working with your local directors of public health, your local councils, ensure that communities do know that there's a lot of support now available to help them if they're infected with COVID or are at risk, and that we should be using those as part of preparing to exit from this phase. So Debbie and Jeanette, I'm going to end there. A bit of a longer update today, but so much is happening now. And as we prepare for exiting the lockdown, I wanted to just share with colleagues some of the issues which I think will be important for us as Londoners. So thanks, Jeanette.
Thanks so much, Kevin. That was a really useful and very helpful update, and I'm sure everyone appreciates the length of the update. All the information is very welcome. So I will now hand over to Martin. Martin, if you can provide an update, and we will then open up to questions which will be chaired by Jeanette.
Debbie, thank you. And because Kevin gave a comprehensive update, I'll be quick. I want to do 3 things, if that's all right. Just to, some of you will have met me before. I'm Martin. I'm the Joint Chief Nurse here in London, a privileged position for me. I want to say three things. One is a bit about the pressures the NHS is currently under and what that means for families and communities. Secondly, to echo some of the messages about the vaccine that Kevin shared with you. And then thirdly, I'm very fortunate to have some brilliant medical colleagues. You've met Helene in the past, one of my medical director colleagues. Tonight I've got Dr. Vin Diwakar with me, who is the most senior doctor in the city. He's the medical director for the NHS in London, and I asked if he would give a couple of reflections on where we are on these things as well. I thought that would be valuable for you to hear from the city's top doctor. So in terms of pressures, the NHS remains under significant pressure. Any of you who support carers groups and volunteers in our hospitals or in our primary care situation will know that. Our ITUs are full of people, many with COVID. And unfortunately, I still get an email every day that tells me over 100 Londoners have died from COVID in the last 24 hours. And that, as we've said before, is 100 families ruined, 100 families grieving, 100 communities losing a valuable member. And we don't want that to happen. So we need to keep on doing the basic things right. And your messaging on this is really important. Hands, face, and space. Follow the rules. Let's get rid of this virus, and let's get back to living our lives collectively as communities. The NHS is doing a great thing. Doctors and nurses working hard all hours, of course, and we'll continue to do that. One of the things we're joyfully working on is the vaccine programme. 1 million people in London vaccinated by now. That is fabulous news. That's 1 million people of the most vulnerable who, if they catch COVID, will be less ill, will not die. It is really positive, but there's more to do. And we are doing that at 190 different sites currently. We'll change that. We'll start to use more church halls, more temples, more community venues. We'll do that as we spread up. But for the next couple of weeks, we are focusing on London's most vulnerable. So that's people over 70. That's people who are in care homes for the elderly. That's the extremely clinically vulnerable and those who work in caring and healthcare settings. And if we vaccinate them, then that will be great. But we are seeing an inequity about vaccine distribution because some communities are more hesitant. Give you a couple just so that you know. One is we know that men are more likely to say they'll have the vaccine, and surprise, surprise, are less likely to have had it. And my wife tells me that is not to her surprise. More importantly, we are seeing that those in the poorest levels of society, those in the bottom section in economic well-being, are less likely to take the vaccine. And of course, it's the poorest in society who are most affected by ill health. So we really need to work with those most in need to take up that offer of the vaccine. And then we're seeing it in those different ethnic and cultural groups that we see, that we're blessed to see in this city, but we're seeing variation. So if you identify as Indian or British Indian, you are far more likely to have had the vaccine than if you identify as African or Caribbean. And the reasons aren't because people are anti-vax or people are not offered the vaccine. It's because people have different concerns, and we need to listen to those concerns, and we need to give people time and facts. And there were some comments in the chat just now about giving facts to people to make informed decisions. Because in the end, we want people to make a choice to have the vaccine. But to do that, you need facts. And that's what we're doing. We've asked on this call before for more materials in different languages, in different formats. We've got loads now, and we'll share that with Debbie and the team, so you've got access to them. Video clips in a dozen different languages now, everything from Urdu to Swahili to Turkish. We've got those, we've got different printed stuff, we've got all sorts of materials which hopefully is helpful to you, and we'll make sure you have access to those for your networks. But we have vaccinated 1 million people, we've got millions more to do, and we need people to be informed to choose to have that vaccine and make their community safe. So finally, if that's all right, Debbie, I'd just like to ask Vin Diwakar, Dr. Diwakar, just to give a few reflections from his perspective on where we are with the vaccine programme and with COVID.
Thanks, Martin, and thanks everyone. Thanks for inviting me to this. As Martin says, I'm Vin Diwakar. I'm the Medical Director for NHS London, and I'm a children's doctor. I'm a paediatrician by background. So I've had a lot of experience, obviously, with children's vaccinations over the years, as well as being part of this. Again, I think the beauty of these sorts of sessions is actually in the dialogue. So if it's okay, what I'll do is I'll just say a few words, and then I'm going to hand on to my colleague Helene Brown, who's a GP in Newham, to answer some of the questions that are really helpfully coming up in the chat. If hopefully everybody can hear me, if not, switch over.
Put your headphones on, Vin.
Different microphone.
Yeah. Put your headphones on. There you go. Try that.
Martin, can you hear me more clearly now?
Brilliant. That's
better.
fabulous.
Okay, brilliant. Better microphone. So the first thing I just wanted to acknowledge is that I've spent quite a bit of time over the last couple of weeks getting out and about and meeting people. I visited 11 or 12 of the intensive care units around London. I spent yesterday visiting a couple of care homes and spending time in a GP surgery who was delivering the vaccine. I did an ITU shift as a nurse actually on Friday night to do my bit to help out colleagues who are looking after these really very large numbers of patients that we've still got in hospital. And two things really struck me. So I was talking to a lady that was working as a healthcare assistant on the ITU on Friday at sort of 4 o'clock in the morning, and as we were both having a brief break. She hasn't had the vaccine. And the reason why she's not had the vaccine is because she was brought up by her mother and then by her grandmother before that, very strongly being told not to have vaccinations, because there was a belief that vaccines were something that had been used in experiments on Black people in the early part of the last century. And she also remembered the stories about some drug companies carrying out unethical experiments on vaccination back in the 1970s. And sadly, I'm sorry to say that is true, and that did happen back in the 1970s, and it did happen in the early part of the last century. But you know, we have really strict regulations on development of medicines in the UK now. Just a personal fact about me, I'm married and my wife has short arms because her mother took thalidomide, which is a drug which affects development of babies back in the 1960s. So, you know, in some ways at a very personal level, I really care about drug safety and drug development, and I wouldn't be out here personally backing this vaccine if I didn't think it was safe and had been properly tested. And you can get the evidence about both of the vaccines currently being given in the UK in the research trials which have been published, including data on things like the ethnicity and communities that people who received the vaccines in the vaccine trials were from. The other bit to remember is that we've actually now given the vaccine to more people in London and in the UK than are in the published trials. So in London, as of today, we've given more than 1 million vaccines to Londoners now, of whom, for example, if you are Black, 57,000 Black Londoners have had the vaccine. And we've had no reports of serious side effects from the vaccine. So that's a fact. Compare that, secondly, to the fact that 640,000 Londoners have had COVID since the pandemic started. And of those, 13,500 people have to have COVID than it is to have the vaccine, simply on the facts. And what I said to this lady was, you know, if you're delaying the vaccine because of what you've been told about what had happened in the past, I acknowledge and I'm sorry for what happened in the past, but I don't think that's what's happened in this occasion. And the second thing is, you know, the facts are there. This has been tested extensively. We know that it's safe, not just from the trials, but also from our real life experience now of giving the vaccine in the UK and in other parts of the world. The other thing she said to me was that there was a belief that the vaccine had been rushed into development. So as I say, because I'm a children's doctor who've spent a lot of time on vaccinations, the reasons that vaccines have taken a long time to develop in the past is basically because not an awful lot of funding has been put into vaccine development. This is like a major international crisis, and governments around the world, the American government, the British government, governments around the world have put millions of pounds into vaccine development. And the vaccines themselves are not based on new technologies. They're using the same techniques in vaccine development as were used with other viruses in the past, but they've been adapted so that they're there for coronavirus. So they are safe forms of vaccine that have been adapted. They're not something that's entirely new. And then the final two things I say that you hear from people, there's a kind of belief. I remember having a gentle argument with the guard on the train I was taking the other day. He was convinced that one of the vaccines changed your DNA. And I said to him, it does not change your DNA. And I drew a little picture of how it works. So there's a lot of kind of stories out there that I think people believe, understandably. And what I think our approach to this, certainly from the NHS side, and I know that this is true for all of you and for all of my colleagues in local government, is, you know, people have genuine concerns about the vaccine, and there's nothing wrong with that. And what we've got to be open to is making every effort to answer every question that people have got about the vaccine, about why it's safe, about why it works, and how it's going to prevent people from dying. Protect you, protect your family, protect your loved ones, and most importantly, then also helping get our country and our society back on its feet again. Thanks, Martin.
Thanks, Vin. Jeanette, I think you'll want to go to questions now.
Yes.
I hope that was helpful.
Thank you so much, Vin, Martin, and Kevin, for those inputs. We really appreciate the information and insight and context that you share in these briefings. We have a lot of questions and we have a lot of sharing actually of resources. So I want to first say, if you haven't had a look in the chat, there are a number of resources. There are recorded messages from Kevin Fenton. There's a recording of an event by an organization called Ubele that's specifically about vaccine hesitancy. There's a signpost to an event that Brit Bangla is going to be doing on the impact on migrants. So if you just have a look in the chat, there are lots of resources there. So please do have a look. Helene also just posted, who's one of our colleagues from NHS, just posted information for the question that Zrinka, I believe that Zrinka, Ali and Esther had very similar questions about registration to GPs, particularly for asylum seekers and migrants and refugees. And I believe that Helene has posted some responses to that in the chat. So I'm going to go to a question about early years settings, which is not to do with vaccines, because there was a question about, you know, sort of the rationale behind the position on early years settings and whether that is an ongoing risk, and whether you have any views on that. Now, obviously, we don't have kind of central government representation in this particular meeting, but I wondered, Martin or Kevin or Vin, whether you could speak to that briefly. And then there is another question about when will we know whether or not the vaccines prevent transmission? And then I'm going to have a third question, which is about the delay in the second dose of the vaccine being something that prevents some people from getting the first dose, because there is word on the street that if the second dose is delayed, the impact is diluted or it's not impactful. So yeah, so those are three questions. Early years, when we will know about the impact on transmission, and the delay in the second dose. So if we can kind of have responses to those, please.
Sure. NHS colleagues, you'd like me to deal with the early years?
Please. Yeah.
Yeah. All right. Good. That is a question that has come up repeatedly over the past 6 weeks, in part because the rules now say secondary and primary schools are closed except for children of key workers and those who are vulnerable. But early years were kept open, and they were kept open for two main reasons. The first is our understanding of the burden of disease and transmission of the disease and risk of transmission. And the importance, secondly, of keeping early years open, especially to support the children of key workers and to facilitate those who need to be out and about during the lockdown, and ensuring that that provision was still in place. So it was both from the Department for Education's perspective, a combination of limited transmission risk, but also ensuring that the infrastructure was there to support some of the most valuable key workers that are working at this time. Now, the policy will be reviewed on this in the second week of February, along with all of the other restrictions that we're currently living under. And we are actively monitoring the epidemiology to see if we have any challenges occurring in our earlier settings. If we had any concerns at all in terms of transmission of disease, then as a public health director, I will intervene, and I would have intervened. But at the moment, there's nothing to suggest that having that small group of the population still open and mixing is causing any concerns. The final thing to say is, in addition to early years being open, all of you are aware that we have really been increasing the provision of testing for key workers. So the only people who should be circulating now are those who absolutely have to, either because of their jobs or because they're essential workers. And so we have really stepped up our testing and contact tracing for everybody who's working at the moment and circulating, including local test site, key worker testing programs, and of course, working with workplaces too. So early year settings have benefited from that. I'd leave the transmission questions to NHS colleagues.
Okay.
But epidemiologically, I will also, if I need to respond, I'm happy to do so as well.
That's great.
Martin and Vin.
Thanks, Kevin. Helene, if you could pick up the second dose issue, that would be really helpful. I'll pick up on the evidence about transmission. So the evidence we got from the trials, which were tens of thousands of people, showed that the vaccine was effective to minimize the illness should you catch COVID. There was not enough people to be clear about whether it stopped you catching COVID or whether it stopped you transmitting it. So it's really important for the time being, until we have that evidence, that we practice the things that will stop transmission. That's washing your hands, keeping space between you and other people, and covering your face. And then when you're inside, ventilating. That's the thing that we know factually stops transmission. And that's what we want everyone to do. And because we're doing that, the numbers that Kevin described right at the beginning are coming down. Now, hopefully, as we vaccinate millions of people, we'll start to see over time whether that itself stops transmission. I'm saying don't wait for the answer for that. Do the things that we know work. And then there is concern, you're quite right, about just delaying the second dose deplete the efficacy. And I think, Helene, we're fairly clear about where we're at on that.
Thanks, Martin, and good evening, everybody. My name's Helene Brown. I'm a GP in Newham, and I also work as one of Vin Diwakar's deputies in the London region at NHS England. And I've been working with the team who've been doing the rollout of the vaccination programme as well. You're right, Martin. There's been a lot of work looking at the decision to make about when we should have the second dose of the vaccines. The decision is not made at a regional level, as you would imagine. The evidence is reviewed in detail by a group of people who work in this area who are experts. They're called the Joint Committee of Vaccinations and Immunisations, the JCVI. You will have heard a lot about them, I'm sure, over recent months. And what they found when they reviewed all of the evidence is that there is actually very high levels of protection from the first dose of the vaccine. And then with all of the evidence, they've done some modelling work where they've looked at all of the data and analysed it. And the modelling work suggests that the single dose of the vaccines will prevent more deaths and hospitalisations than vaccinating a smaller number of people with 2 doses. And so on the basis of that, they made the decision to say, let's vaccinate more people over the country who are in those very vulnerable groups of people. And that way we will be able to reduce the number of people who die and the number of people who become very seriously unwell. And we'll be able to do that for more people than if we gave a smaller group of people 2 doses of vaccine. When they have looked at that data as well, they've also are expecting that giving the second dose at the 12-week mark is going to be as expected or possibly even more effective than if it was given earlier. And so with both of those bits of information together, that was why they made that decision at national level that we should do the first dose and then do as many people with that as possible, and then ensure everybody gets their second dose. We're now suggesting that that's between 11 and 12 weeks now for the second dose of both of those vaccinations. Does that help, Martin?
Thank you, that's lovely. Jeanette.
Brilliant. Thank you so much, Helene. Okay, so I'm going to run through a few more questions. I'm going to try to go through about 3. Sorry, I was muted for a second there. Yeah, I'm going to run through a few questions. One is, what kind of concerns are we hearing about the Jewish community, all parts of the Jewish community? There was just a general question about there being some reports of vaccine hesitancy. Have you been hearing that? Yeah, what's your position on that? You know, what can be done? I suppose it's kind of similar to any other community where there is a high level of hesitancy. There is a similar question around hesitancy saying, you know, there are different concerns. Should we be having different campaigns for different kinds of concerns? Which I can probably start to answer to an extent, but I can hand on to my colleagues as well. Then there's a question about what impact will the fact that we're coming out of lockdown, knowing some people are vaccinated and some people are not, is that not a bit of a dangerous mix? And how do we manage that reality? I think, Martin, you started to talk about continuing to safeguard ourselves in the ways that we have been, but if you can just speak to that.
Yeah.
And yeah, so it's 3 questions. One is kind of what we've been hearing about the Jewish community, different concerns, different campaigns, and kind of coming out of lockdown with a kind of bit of maybe inequality in terms of who is vaccinated.
Yeah. So I as a giver of the vaccine, I'm probably least qualified to talk about the concerns from any community. There was a hand shot up from Paul as you asked that question, because I think people have different views. We hear concerns, and please tell me if I'm wrong. You know, is it kosher from to have it? Is it halal? That's not my decision to make. I can tell you the ingredients of the vaccine are none meat, none porcine, none bovine, completely synthetic. And spiritual leaders need to help us understand that for our own communities. What we have got is facts about what the benefits of having the vaccine are, and working with communities and with groups to place that in a way that resonates with their own communities. And we're happy to work alongside, but I don't think it's for me to be declaring something for a community. I want to work with communities. Helene wants to come in as well, because And you work far closer day to day.
Thanks very much, Martin. Just to say, I've just put 2 links into the chat with information for the Jewish community from leaders within those communities, which I hope people will find helpful around the specifics. But just to add that, that there's no pork, there is no beef, and no fetal material within the contents of the vaccinations.
Thank you. On different communications, yes, absolutely. This isn't a one-strand communication. Jeanette, you know that better than I. This is about working alongside communities, their different fears, their different concerns. If you come from a family, sorry, my phone's making an awful noise. If you come from a family that is of Nigerian extract, for example, you will have a different lived experience to that if you come from a Polish background or a different faith background. And the experience, for example, in Nigeria over the last 30, 40 years is very real. And we've got to acknowledge that of working with certain drug companies. And that's just one example. So I think we need to have communications for different groups at different levels, but and delivered by different people. Various people, not me, but all of us need to play a part in this. And I can play my part. Helene can play hers. Jeanette, you can play yours. We all need to contribute to that. And then that third question, just remind me again, Jeanette.
The third question was about, as we come out of lockdown, if we come out of lockdown, and some people are vaccinated, others aren't, what's the implication there?
So what we can't afford to do as a society is start to label people as vaccinated, not vaccinated, not safe, safe. You've seen what happens when people can't wear masks on a train, get abused, but they can't. So we've got to be really inclusive in this, but we have to make sure that enough people have been vaccinated to make sure that those deaths drop down to nothing. That's the key in this. We mustn't start to other parts of society because they've been more hesitant than I have. Just because I'm willing to have the vaccine, other people have concerns and take more time to come to terms with that. And I think we've got to work with our lovely city, not work against each other within it.
Jeanette, if I could just also reflect on a couple of things. So the first, I agree with Martin on the conversations that we need. And in the chat, I think colleagues are right to point out that the hesitancy issue that we're grappling with now didn't start yesterday. It reflects a much more long-term disconnect, distrust sometimes, or just not being engaged experience that many communities have that have predated COVID, that have been made worse by COVID. So in addition to what Martin has said about the types of conversations and the different levels, what I also am promoting and what I'm keen to see is that there's consistency and there's longevity of these conversations, because what we're doing now and what COVID has allowed us and all of the pain we've gone through is actually to sit down and confront some of the issues that needed to be confronted. And we will continue to do that. And that's why conversations such as these today and replicated across the city are going to be so important, because unless we get to that point of uncovering the things that aren't said and acknowledging the fears that people have, you can't shove these messages down and you can't shove the vaccines into people's arms. You have to meet people where they are. And that's exactly what we're doing today. So I just wanted to also reflect on that. Our commitment is that this isn't just because we're in the middle of COVID. What we're establishing here is a new way of working together in the city that is in the country, which I'd argue is long overdue.
Absolutely. Thank you so much, Kevin. That's a really kind of helpful way to think about it, that we need to kind of move this conversation forward. And I think there've been lots of comments in the chat about the need to have an honest conversation, the need to be open and transparent. I think there's a real kind of appetite for more information. There was a specific ask around information on clinical trials. So I wonder if someone in the team or in one of the from one of the organizations can drop that in the chat. If we can't drop that in the chat now, we'll definitely send it as a follow-up. I'm going to move on to a few more questions. I'm hoping that we can get through as many as possible. So there is a question about basically, there are a couple of questions about who gets to have the vaccine, right? And there's a question about whether charity workers who are working on the front line should, whether some, other, teachers and, the different groups that can have that. What position are we in now, kind of policy-wise, around who gets the vaccine, apart from, we know that we're going by age and vulnerability in terms of pre-existing health conditions. So that's the first question. The next question was about having an open conversation about side effects. And I think it links into a specific question from, I think it's from Bridget, about is there a difference in terms of, what your ethnic background, in terms of side effects or the impact that the vaccine will have on people. So that's three questions. One is about, sort of charity workers, teachers, other people who are interfacing with the public. Will they be vaccinated quicker? Side effects and specific impact on ethnic minority communities.
Martin, I think you're on mute.
Oh. Martin, we can't hear you.
That's because I haven't, that's why, because I didn't have me microphone on, I'm sorry. So Helene, if you could do the clinical bit about the side effects, I'll do the policy bit. The next couple.
We've lost you again, Martin. I'm not sure what's happened. Hello, Martin?
And the groups we are focusing on will save the most lives. So under no apprehension, if you vaccinate the elderly, you will save more lives than any other group. Doesn't matter whether it's occupation or whatever, that's the most effective way to save lives. Now, once we've done the top priorities, and there's 9 priority groups, there will be a conversation which will be starting at policy level now about how next do you then reach people. And I don't know the outcome of that. That's not within London's gift. But the reason we are focusing on the over 70s caregivers and those in care homes and the vulnerable is because they're the people who are most likely to die if they catch COVID. And I can make an argument for school teachers. I can make an argument, genuinely an argument for bin men. I can make an argument for bus drivers. All have been affected by COVID in a significant way, but not as much as by those first groups of priority. That's why we're doing what we're doing. And that's harsh at times because people can make a personal case, but this is looking after 9.5 million Londoners, 50 million people in England, 60 odd million in Great Britain. That's what we're doing this for. As for side effects, Helene, there aren't many.
So in terms of side effects for both of the vaccines, for both of them, you can expect to get a sore arm at the site of the vaccination. Sometimes people might get a small amount of localized swelling and sometimes a little bit of redness, and some people have reported a little bit of itching around that site. A small number of people, so it's less than 10%, the following day or 48 hours afterwards, experience of generalized body aches and pains, and some of them do experience a slightly raised temperature, and some people have reported feeling tired or having headaches. All of those impacts, all of those effects are expected, they're normal, and they have been noted to be well managed and well controlled by just taking regular doses of paracetamol. So 2 500 milligram tablets of paracetamol up to 4 times a day. And with that management, people have found that they get back on track fairly quickly afterwards. It's usually no more than 24, 48 hours if they do experience those side effects.
And specifically, Helene, for any particular cultural or ethnic background, there aren't any specific side effects specific to any particular group, are there?
No.
No. And that's after vaccinating in this country alone 8.5 million people There's been nothing distinguishing between any of us, man, woman, ethnicity, whatever.
Helene, can I just come back with a question about that? Because you've just kind of said that most people kind of get back to normal. I mean, if there wasn't going back to normal, what would that look like?
Jeanette, I've probably not used the most eloquent language there. I do apologise. That's probably my tiredness at the end.
Long day.
Midway through a day, actually. So I do apologise for that. No, it's if people have experienced having a flu vaccination, or if they've experienced having any other vaccination, perhaps when they've been travelling, that, you know, most people experience the sore arm. That's the most common thing, and then in less than 10% of people they feel, you know, sort of flu-like symptoms or aches and pains, tiredness, headaches. That's it. It resolves after 24 to 48 hours. I apologise if I wasn't clear there, Jeanette.
There's no long-lasting effects that we've picked up at all.
No.
Yeah, and Jeanette, most people will have, or many people on the call will have some experience of having the flu vaccine and having that sort of reaction, either the localized reaction that Helene has mentioned, or some of that sort of achy feeling for 24 hours that follows. And that's normal, especially with adult vaccination programs, to get that. So just to put that in context, this is what we're speaking about. And Jeanette, just one thing on the cohorts, just to reinforce. I know colleagues are saying, well, you know, why didn't they offer it to BME communities first? Why is this not prioritized? But can you imagine, colleagues, if we did do that, if that was it, that we were going to give this vaccine first to particular groups, the challenges that would have caused as well, because in an environment where communities may be mistrustful, actually doing it by age cohort and vulnerability, and then maximizing every opportunity we have for all communities to take up the vaccine when their cohort is called, is perhaps the best way and the most inclusive way to do it. So just to reflect on, as Martin says, it's done to reduce harm, but also it's a way that allows us to have a much more objective way of going through the population as the vaccines become available.
Thank you so much. There's only one more kind of substantive question that I have, but I just wanted to run through some of the comments that we've had in the chat.
Yeah.
There was a comment about access to vaccine, actually more than one comment about access to vaccines, both in terms of physical access, but also for people who may be living with financial hardship and are unable to travel. And so I just wanted to kind of to log that comment, because I think it's really important, because it's a different kind of inequality, but on both fronts, it's different kinds of inequality. And then there was a question about test and trace, because this is not to do with vaccines now. This is to do with coming out of lockdown, because I think the idea, my understanding from the question, is that the person who's asking the question understands that we were meant to go into lockdowns so that we could sort of sort out vaccinations, but also test and trace to see whether or not that could be more impactful. Is there any update on test and trace, and what information can you share about where we are with test and trace right now?
Shall I do that very quickly? We are in such a better place, Jeanette, with test and trace. All local authorities now have a robust testing infrastructure in place, from better home-based testing to local test sites to mobile testing units. We're doing the work now on the new variants in a few of our boroughs, and that's adding additional capacity. We've also have all of our boroughs doing local contact tracing. So councils are working with the National Test and Trace program to ensure that anybody who's diagnosed gets the support they need. And of course, councils have been working on getting payments and support to people who need to isolate out in a much more quicker manner than we did before. So the infrastructure that we now have in place is infinitely better than we did, both coming into the lockdown and compared to last year. So, we have to get the rates down really low, because contact tracing is really effective when rates are low, below 50, between 50 and 100 per 100,000. And we're still not there yet. And that's why we really want to drive rates down so that the contact tracing system can kick in to control the infection. But London's really much better prepared.
Brilliant, thank you.
Can I just pick up on the access?
Sorry, go ahead.
Just quickly on access and economic access. One of the great things about being in London is, of course, we're all living cheek by jowl with each other. So there are vaccination centres very close to people, but we acknowledge that we have them more and in different places. Over the next few months, we need to move them about so that everyone gets that access, Jeanette. I think it's really important. And I noticed one comment in the chat which really struck a chord with me about us being pushy. I don't want to be pushing this down anyone's throat. What I want to do is give people facts. The reason why we're so passionate about it is because I've seen the devastation that this affects the communities we all represent. And that is just heartrending. So you can't blame us for wanting to say, here's a vaccine that will stop this trauma and this loss at the scale we have seen. So if it feels that we're pushy, it's not because we're being dictatorial. It's because we care so much about getting this right for the city.
Thank you so much, Martin. So there were a few other comments. There was one that I wanted to just flag from Humanism UK about the kind of facts and figures about people who are humanists. Can you just look in the chat for that? And then just a general plea for more social media to dispel some of the fake news. And definitely that is something that is a priority for all of us across London agencies. I know that we have a poll. I'm going to beg people to stay on for the next 3 minutes to do the poll. And I'm going to ask my colleagues to bring it up. I'm sorry for chairing badly and running over, but if you can stay on for until 5 past, it's up. Please scroll down because there are a couple of questions in the poll, not just one. So please, can you just stay on for the next 3 minutes? And while you're doing that poll, I will thank Dr. Debbie Weeks-Bernard, Professor Kevin Fenton, Martin Machray, our Chief Nurse, Dr. Vin Diwakar, and Helen Brown, and everyone else who has made this possible, particularly the members of my team who have worked really hard to keep these briefings going. So thank you everyone for your attendance. Please stay safe, and we look forward to seeing you again in about a month's time. We will give you a couple more minutes to fill out the poll, and then we'll end the call. Thank you so much for your attendance.
Thank you, Jeanette. Thank you for inviting us.
Thanks, Jeanette. Thanks, Debbie. And thanks, everyone. Take care. Be safe.
Take care. Be safe. Bye-bye.
Bye, Martin.
Thanks, everyone.
Thank you. That was
Thank you. You safe.
Thank you. Brilliant.
Thank you very much. This was really
Thank
useful.
you.
Really useful.
Someone's just said in the chat that the submit button isn't working.
We're still getting responses through, so it might be because it was pressed.
Thank you so much. Update everything. Thank you.
It might just be a gremlin in the system.
Random question, Jeanette, if you don't mind me asking.
Sure.
If my name is John, and I represent a community based in Southeast London, Town Hamlets. If you were planning kind of community type events around this, what's the best way to engage maybe with someone from your team? Because I find that it's often helpful to have that kind of, engagement from the top as well as from the bottom, just so you have that kind of cohesive approach.
Oh, absolutely. So you drop us a line. I can drop the email address